Hello, my name is Helena Dominguez. I am born in Barcelona, Spain, and I am living and working in Denmark. I am a cardiologist, consultant in Bispebjerg and Frederiksberg Hospital, and I am associate professor in the University of Copenhagen in the biomedicine department. In a university seminar for health professionals from Brazil, Mexico, China, Vietnam, and other countries, I presented some telemedicine projects that I'm working on, and the colleagues from Brazil were inspired, and we had some discussions, and we have figured a Brahit Brazilian heart insufficiency with telemedicine project. The key issue for these projects is that patients that are isolated either socially or geographically, like in the slum areas of Rio de Janeiro, the favelas, they are difficultly reached by the specialized cardiologists and by their own doctors in primary care. These patients can be reached through community agents, which is actually a setup that is originated in Rio de Janeiro. And these community agents are neighbors that who know the patient, and they are living in the community. They are able to make observations on the patients and bring that information to primary care. And primary care can give, the doctors and nurses can give advice to the patients through these community agents. So they are a key for this study. Another important part of Brahit is educational material for primary care that is produced in the University Federal of Ouro Preto, and they are leaders of e-learning material for primary care, and they are elaborating this kind of educational programs for tailored for primary care according to their skills. We are three partners: the Department of Biomedicine, the University of Copenhagen with Bispebjerg and Frederiksberg Hospital, and the two Brazilian partners are INC, Instituto Nacional de Cardiologia, and UFOP, the Universidade Federal de Ouro Preto. Beside the three partners, we have three Danish companies that are collaborating in the study. One is Trifork, which is supporting data exchange across sectors. The two other companies are Visicon and Cortrium. Visicon is creating films to explain the patients about their disease and how to manage medications and the treatment. And Cortrium is making a sensor for recording heart rhythm in a very simple way. So the most exciting actually from this project is the spin-offs of the project. Visicon films are now ready to use in Portuguese in Brazil, but they are also now having Danish speech. So I can use them in my outpatient clinic with patients that due to the COVID-19 crisis, they are not able to come to the hospital as they used to, and we are now able to show them this with educational material. And then we have another spin-off that is really exciting, and that is through the Innovation Center in Sao Paulo that has facilitated our contact with another Danish research group, which is Philip Brahit, and they do have an unsolved issue with monitoring heart rhythm, and we are using the C3+ sensor now in the jungle of Amazonas, and this is something happening now. What I would suggest private companies that want to introduce their products in Brazil is to do it research-based rather than making a complicated commercial approval first and then making a clinical validation, just the other way around, to make it introduced, tried as a project, as a part of a project. At least this is my advice as researcher. And also as researcher, I really want to emphasize how amazing it is to work with my colleagues in Brazil. They are very professional, very skilled, and they really have patience. They have big amounts of patience, very well established system for ethic committee, and everything is clear how to make it. That doesn't mean that it's easy. It is not easy in Denmark either, but is really ready to do that. Thank you.